Hi guys, I'm back for round 3 of the CDA review. And I gave it some thought and I'm going to read through the answers and rationales why that is the answer, instead of just reading every single question to speed it up, because some of you guys need to study this now. So here we go. I'm going to leave off with, it was question 141, okay? The answer was E, and the antibiotic would be prescribed if the patient exhibits all or any of these signs and symptoms of infection. And then the next one is sodium hypochlorite or bleach is utilized more often as an irrigating solution, as it is dissolved dead tissue in addition to disinfecting and bleaching the canals. Hydroperoxide 3% may be used to an alternative to sodium hypochlorite. Peroxide is an effectant and functions in bubbling out debris and disinfecting the canal. Glass B sterilizers require the numb of the instrument to be completely submerged in the unit for 10 to 12 seconds at a temperature at 450 Fahrenheit. Now this is much better. The Gates Glanton drill is utilized with either the slow speed contra-angle handpiece or the friction grip straight handpiece to enlarge the canal. This is 145 in this book. Remember, I'm leaving the links below for you guys. Trans illumination with the fiber optic light is a valuable diagnostic tool, as it allows the operator to compare the differences in the degree of translucency from one tooth to another. In addition, fractions may be viewed during the procedure. I still got the ear thing going on for me, so sorry about the words. All of the aforementioned statements describe a radiograph that is acceptable for diagnosing an endodontic condition. Okay? And that is question 146, and I think I need to read that one to you guys because it just doesn't explain it good enough. When the auxiliary exposes a radiograph for endodontic diagnosis, the resulting picture should A. provide a current representation of the entire tooth in a significant amount of the periapical area, including the apex. B. Dimensional occurrence. Possesses quality, density, and contrast. And the answer for that was all the information statements described in a radiograph that is acceptable for diagnosing an endodontic condition. Next one is all of the aforementioned subjective symptoms will be felt by the patient and are valuable clues to aid the operator when diagnosing endodontic disease. The question was subjective symptoms that may be felt by an endodontic patient may include A. pain, B. pressure, C. nausea, D. all of the above, which was all of the above. An abscessed tooth will react this way when the stimulus of hot and cold is applied to the area. When a piece of ice is applied to the tooth surface immediately, followed by a stimulus of heat, and the patient perceives pain, then it will appear that the pulp is an abscessed tooth will react this way. It does ring up a bell though, because most of the dentists I've ever worked for use that endo ice, that spray, to test the pulp. I've even seen them use ice and a Carpio that was sterilized, of course, and then the Indus to clean your keyboards, It's like a freeze spray. I've seen them use that. So, unfortunately. But anyway, with that being said, I know they're going to be asking a lot of questions about endo. Pulpectomy is the surgical removal of the vital pulp from the tooth is known as pulpectomy. So the surgical removal of the vital pulp. Key word. During an apoectomy, the apex is retrofilled with, so this is during an apoectomy. The canal walls in the apical third of the master cone are coated with cementing medium prior to being placed in the canal. Radiographs are utilized to evaluate the patient's periodontal disease. The assistant should expose vertical bite wings so the dentist can view the vertical bite wing and a current bite wing radiograph, meaning a good radiograph, which is vertical, up and down, people, exposed, will allow the dentist to access the height of the bone in the root surface area in addition to determining the amount of crestal bone loss. A periodontal probe is utilized to measure the depth of the sulcus. A normal sulcus reading is, a normal sulcus reading is no deeper than 3 millimeters. 3 millimeters. Normal sulcus reading. Suprabony pockets involve the, so what does the suprabony pockets involve? Involve the coronal portion of the gingival above the level of the alveolar bone. Okay, so it's the coronal portion of the gingival above the level of the alveolar bone. Treatment of periodontal pockets include D, all of them, which is removing calculus, plaque, and bacteria with the use of instruments. So this is a treatment of a periodontal pocket. How you treat it. You're going to remove it, okay, with the use of instruments. Cleaning an area or a pocket and removing the necrotic tissue in the area, dead tissue. Necrotic. That's spelled Necrotic. Smoothing and slightly contouring the root surface to remove the necrotic material found in the pocket. Okay, and that was all of them. This is question 160. Alcohol consumption. I can't hear, people. Alcohol consumption is contradicted after periodontal surgery. The patient be instructed not to consume alcohol beverages after periodontal surgery. Remember, it increases the bleeding. Alveoloplasty involves, this is alveoloplasty, spelled Alveoplasty. Surgical reshaping of the alveolar bone is known as alveoloplasty. This process is performed to remove defects and to restore normal contour of the bone. This is 162. Pericranitis, spelling Pericranitis. Icoronitis is a condition caused by inflammation and infection of the gingival tissue surrounding the crown of the tooth. The teeth most commonly affected are the mandibular third molars are usually affected as they are difficult to cleanse and often accumulate food debris. That's why a water pick is awesome. They have a shower flosser too. I'll leave that link below so you can check it out. Alright, let's see here. That was 162. 163. Periodontal dressings may be purchased eugenol and non-eugenol. EUGENOL. And non-eugenol periodontal dressings may be purchased. However, the non-eugenol dressing may be preferred by the dentist as it is less irritating to painful tissue. Non-eugenol is best. Necrotizing ulcerative gingivitis is a, I'm going to spell it, necrotizing, NECROTIZING. This is going to be on the exam, people. And then the ulcerative, ULCERATIVE, gingivitis. Acute necrotizing ulcerative gingivitis, or Vincent, like the name, infection is a bacterial infection. Typically, the patient may feel tired, have a foul odor to their breath, and exhibit grayish or yellowish gray ulcers that are scattered throughout the oral cavity. In addition, a white, I'm going to spell it, PSEUDOMEMBRANE. Periodontal membrane, it's something membrane, forms over the ulcers. However, it may be wiped off. So that P word is a membrane that goes over the ulcers, but it can be wiped off. And remember, the acute necrotizing ulcers are like a grayish white, okay? And also the name of it, the proper name is the Vincent's disease. All retaining to the gingival tissue, okay? So you not only have you now have this on the exam, which is dealing with the periodontal tissue, okay? It's not just about composite and amalgams and those instruments and that simple stuff. Osseous surgery may be OSSEOUS surgery may be additive osseous surgery attempts to restore the alveolar bone to a normal level by utilizing, wow, some of these words, AUTOOSSEOUS implants, Osseous implants, to stimulate bone cell formation. Subtractive osseous surgery resets, reshapes, and recontours of the bone by surgical means. So, subtractive osseous surgery, it resects, reshapes, recontours the bone by surgical means, okay? A periodontal abscess usually forms in the gingival tissue. It usually does not involve the pulpal tissue or the apex. Post-surgical periodontal patient usually requires a strict oral hygiene regimen that includes recall appointments scheduled every. So this is post-surgical periodontal patient. Okay, so if you have a patient in your office, this is your chance as a front office person as well to make sure you're getting them in for another exam, which will help with production, but also help with your patient, okay? We got to think two ways, business and for the patient. And it'll be a quick appointment, so why not? And that should be done, and I'm sure there's a code for it. Recall appointments for post-surgical procedure for periodontal patients should be scheduled every 1 to 2 months. Drinking cold fluids for the first 24 hours will help keep a periodontal dressing firm. A. Drinking any type of cold fluid, such as water or soda, will allow the periodontal dressing to set. So if they drink hot coffee, it's going to melt it and warm it like chewing gum. And it looks just like that, chewing gum. Excuse me. And if you ever have the chance to help a periodontist, let me talk right. It's so easy. I have one dentist. He's passed away also. I've done this too long. I want to say his name was Dr. Valentine. But anyway, he was with a group at an orthodontist office, and he would expose these teeth, and we would have to put the brackets on and everything. And he paid me $50 a week just to remove the dressing. And it's so easy to just gently lift up and remove it. So there are other ways you can help out in your office. He also got us a honey baked ham every year for the holidays. God rest his soul too. In order to obturate sensitivity for periodontal patients, the dentist may prescribe the dentist may advise the post-surgical periodontal patient to use a commercial desensitizing dentifrice or a 2% solution of sodium fluoride in water to brush in order to decrease the patient's sensitivity. Okay? That desensitizing dentifrice is DENTIFRCE. Okay? And don't mind my mess. I got a lot going on here. I'm trying to get to other videos for you guys, like if you need to know x-rays and the degrees and just a bunch of stuff. Even advertising the book that I wrote. Sorry, I had to take a break from this for a second. Okay. Doing this for you guys. Please like it. Okay. 170. Ideally, the pediatric patient, so now we're moving to pediatrics, should have his or her initial dental examination based on the following guidelines. All the information factors should be considered in planning a pediatric patient's first dental visit. So what are they? Growth and development of assessment, high risk for caries, all of the above. Okay? So when you're thinking about doing an initial exam on a child, normally it's called a happy visit, but you want to see their growth and development and high risk for caries. Are they high risk? Or are they walking around with that sippy cup without water in it? A medical history of a child's patient includes, this is a child's medical history. This is all of it. So, which is parent information, prenatal and natal histories, postnatal and infancy histories, and that's all of them. Pitt and Fisher sealants are indicated where or when. When the dentist observes a deep pit and narrow fissures in the child's dentition, as well as teeth that are prone to caries, he or she may recommend those areas in question to be sealed. Okay? And that's Pitt and Fisher sealants. Now, talking about sealants, there's some adults that constantly get the cavities. If they have a virgin tooth, their insurance won't cover it, but it's cheaper than a filling. So suggest that to your boss. You might be onto an idea for the office with revenue. So, and especially if you can do sealants, say, why don't we start offering adult sealants? They still have to be careful with the sticky chewy candy, as we all like candy, most of us. Okay, well, you can tell I do. Anyway, we're gonna keep going. Like I said, I'm gonna teach you guys on YouTube as if you were in my classroom. I'm down to earth, and we just go through the material, soak it up, observe it, utilize it, review it, so you can ace your tests. You can ace your tests. You can. All right. Are you awake? Okay. This is another fun one. 174. Barbiturates must be administered to a child blink prior to dental treatment in order to be effective. 174. The child is usually given barbiturates 30 to 45 minutes prior to the scheduled appointment. Make a man. I lost my teeth. Kind of relaxed kind of feeling. Okay? Tranquilizers must be administered to a child prior to the dental treatment to be effective. In order for tranquilizers to relax and calm the fearful child, they should be administered 24 hours prior to the dental appointment. Okay? 24 hours. 177. Prior to the application of a sealant, the tooth is cleared of debris and polished with a what? A fluoride-free abrasive such as pumice is usually utilized to cleanse the tooth surface prior to the application of a sealant. Fluoride neutralizes the etching liquid, therefore it does not allow the sealant to adhere to enamel surfaces. So whenever you're doing sealants, or bonding brackets, okay, you want to etch with a pumice, the gray pumice, a fine pumice. You do not need prophy paste with fluoride in it, okay? Anatomically, primary teeth differ from permanent teeth because all the formation qualities are anatomical differences between the primary and permanent teeth. So it's all of them. Which is, enamel plate is thinner, so the top layer of a baby's tooth, a primary tooth, a baby tooth, child's tooth. The enamel plate is thinner. There is a broad molar contacts. The pulp chambers are larger and the pulp horns are higher. Matrix for the pediatric patients include. So what kind of matrix system for pediatric patients when doing films? It says all of them. T-band and ivory, a Toffemire. I know what a Toffemire and T-band is. I'm not sure on the ivory. 180. A tooth that is avulsive has been avulsive. An avulsive tooth has been knocked free from the oral cavity. This is an emergency situation that requires immediate attention. Okay? That's why mouth guards are important. And if the whole tooth comes out, put it in milk. It helps it. But if it's half the tooth, it's not going to help. Direct pulp capping encourages the formation of secondary dentin over the exposed pulp. So they're saying, is it true or false? Direct pulp capping encourages the formation of the secondary dentin over the exposed pulp. Direct pulp capping is preferred to stimulate the formation of dental ridge or secondary dentin over the exposed pulp. A vital pulpotomy involves usually includes the pulp horns. Sterile technique is extremely important as contamination by blood and or saliva may cause the procedure to fail. Okay? That is for a vital pulpotomy. A bite plane encourages a lingual position tooth into the normal facial alignments. A bite plane encourages a lingual position tooth into normal facial alignments. The bite plane is comprised of cold cure acrylic. Its function to move a tooth that is positioned lingually into the facial alignment. Hope everybody's doing okay. Okay, 185. Chloral hydrate is a mild sedative that can be utilized when a pediatric patient is scheduled for extensive treatment. Chloride hydrate is administered orally to produce mild sedation in a pediatric patient. The drug causes drowsiness to occur. 186 is all of them. The patient's role during orthodontic treatment includes, this is the patient's role, keeping regular appointments, maintaining proper nutrition, practicing good oral hygiene, placing and removing elastics, headgear as directed by the dentist. So if you're going to be doing ortho, just know they have to keep their appointments, and normally you have them sign a contract with this. Maintaining the proper nutrition, basically eat good food, watch what you're eating when it's hard, nothing too sticky. That sugar can sit around the brackets. Make sure they brush good on top of the brackets, underneath the brackets, and across the brackets, and get around there on the tubes. And they have to wear the rubber bands or headgear when necessary at home, or their Hyrex, get it turned. Oral habits that may affect the detention include, these are oral hygienes that can affect your teeth. Oral habits such as those listed may affect, so it's all of them. Tongue and thrust swallowing. Thumb and finger sucking, not going to do that, germs. Mouth breathing. Some guys might have to get their teeth checked. And that's it, okay? Malposed teeth and unattractive smile may cause difficulty, psychological, and social adjustments as a child matures. Too many bullies out there. I even wrote a book about bullying. Check it out. It's Skipper Outsmarts the Bully on Amazon by Teresa Biggs. But anyway, that affects them psychologically with their smile, and that's why even as they grow up, they're like, people talk like this. You know, I have an overbite. I work in the field, and when I smile in a picture, I don't go, you know, I don't like it. So, lost my place because I was talking too much. Sorry, guys. 188. Psychological and social development may be impaired if the child feels inferior to malocclusion. Okay? And a lot of kids can't afford it these days. Even TennCare won't pay for it. Preventive orthodontic treatments involved. This category of orthodontic treatment allows the dentist to discover generic and congenital problems and, if needed, begin to formulate a long-range treatment plan. Orthodontic study casts may be taken with blank impression material. Algin may be utilized when obtaining impressions to produce study and working casts. The material that is utilized to cement mental orthodontic bands is, so this is cementing metal orthodontic bands. Zinc phosphate cement is utilized to cement metal orthodontic bands. Don't be looking for your brand name, but that one. Dr. Arnold used to use this blue one, and I loved it. But zinc phosphate cement is utilized. Zinc phosphate, metal bands. Put it in here. It's a big test. It costs a lot of money. Extraoral anchorage is provided if the patient wears a extraoral anchorage is worn when the patient's maxillary first molars are anteriorly positioned and the maxilla is growing too rapidly. The vertical and oblique or high pull headgear utilize a cervical strap to provide traction. And if you think about becoming certified in orthodontic, which you can, these are some of the questions that are going to be on that one. Reciprocal force is the reaction that is produced by anchorage. True or false? Reciprocal force is the reaction that is produced by anchorage. During orthodontic treatment, the resistance of one or more teeth is utilized when moving a single or several opposing groups of the teeth. It's true. A patient's profile may exhibit a prominent mandibular when the individual is classified as having a what occlusion? Okay. Class 3 is a mesial occlusion and evident when the mesial buccal cusp of the maxillary molar occludes in the interdental space between the distal cusp of the mandibular first molar and the mesial cusp of the mandibular second molar. The patient's profile shows that the mandibular is protruding and appears to be mesial to the maxilla. Okay, so for that question, if it's on exam, because this is a study guide, a patient's profile may exhibit a prominent mandibular when the individual classification is having a what? Class 3. Class 3, lower jaw is forward. Resorption. The process of resorption occurs readily with 48 to 72 hours of activation of the orthodontic appliances. Resorption is responsible for compressing the periodontal ligament, which in turn stimulates the osteoclasts to break down bone in the direction of the tooth movement. I'm going to spell osteoclast because I am doing that caption at the bottom and I don't go back and correct the words. This is too much time. So it's spelled Osteoclasts. And blank, the mesial buccal cusp of the maxillary first permanent molar occludes in the buccal groove of the mandibular first molar. Class 1 or neutral occlusion is evident if the occlusion occurs when the patient is centric occlusion. This is considered to be normal occlusion. If I could do it. I once had a chance to have my lower jaw pushed forward for free because I worked for an orthodontist. I was good on that. 197. Oh, I'm going to have to make another video, guys. My family's home. Stay tuned. Don't forget to like and subscribe. See you next time. Check the links below. Bye.